Hello, everyone, and welcome to today's Adult AML chapter event brought to you by the HealthTree Community for AML program. My name is Katie Braswell, and I'm the HealthTree for AML Community Director. I'm very grateful to have each of you here for our meeting today and for your support in building this adult AML community. I'd like to let you know that today's session will be recorded, and the recording, along with the slides and any resources we discussed today, will be sent via email to all registrants within 48 hours after the event has concluded. Here's a quick rundown of the Zoom features you'll need to know about for today's event. If you hover over the bottom of your Zoom screen, you will see a row of icons appear. To turn on your video, you'll press the Start Video button and press it again in order to turn your video off. We would love for you all to keep your cameras on if you feel comfortable. Doing so helps us to create a stronger sense of community. Each of your microphones should be muted and will be kept off by our team throughout most of the event. You may unmute yourself during our discussion time at the end. Press the chat icon to open up the chat box. If you have any questions or comments for us or for our speakers throughout their presentation, please type them here. And lastly, if you'd like to verbally ask a question or make a comment during the discussion session, you will click on reactions and then the raise hand option. We will review all of this again after our speaker's presentation. And now let's get started with today's event. First, I'd like to thank our sponsors, without whom this event would not be possible: Bristol Myers Squibb, Amgen, Genentech, AbbVie, and Jazz Pharmaceuticals. The topic of our event today is titled Nutrition for AML from Diagnosis Through Transplant. Here's the agenda for today. I will introduce our speakers, registered dietitians Joy and Victoria, and they will spend the next 30 minutes or so giving us their presentation. After the presentation, we will open it up for your questions and comments and end the event with a few announcements. So let me take a second to introduce our speakers, Joy and Victoria. Joy Heimgartner has been a clinical dietitian at Mayo Clinic in Rochester since 2008, where she has been the primary dietitian for the hospital-based outpatient blood and marrow transplant program. She is an advanced practice dietitian and assistant professor of nutrition in the Mayo Clinic College of Medicine and Science. Joy holds a master's degree in clinical nutrition from Rutgers University and is a board-certified specialist in oncology nutrition. Joy teaches pre-transplant patient education classes and works closely with patients and their caregivers throughout their stem cell transplant recovery. Joy's research work includes nutrition assessment in patients with AML. Victoria Vasquez has been a clinical dietitian at Mayo Clinic in Rochester for the past year and a half. She has worked inpatient for hematology and blood and bone marrow transplant teams. Victoria graduated with her bachelor's degree in nutrition and food science from Montclair State University and completed her clinical rotations at Mayo Clinic Rochester. Victoria works with patients with newly diagnosed leukemia and lymphoma. She follows patients through induction chemotherapy and often sees them throughout their treatment course up through stem cell transplant. Victoria enjoys developing working relationships with her patients and seeing their victories, both large and small, as they progress through treatment. We are so honored to have you both here with us today, Joy and Victoria, and are extremely grateful for the important work you do as dietitians in teaching people how to use food to improve their outcomes and helping them navigate the nutrition challenges that come along with treatment. And so with that, I'll let you both go ahead and get started. I don't think we can hear you, Joy.
It's only been 2 years of the pandemic. I still can't remember to unmute.
We can hear you now.
Thank you, Katie, so much for that introduction, and for everybody at HealthTree for putting this together. These monthly topics are such a great idea to connect people and for us as care providers to understand what questions patients have. That really helps us. So I'm gonna make sure I can advance my slides here. There we go.
All right. So as Katie and Joy said, so I'm Victoria, and today we're going to be covering 3 different topics in regards to nutrition during active treatment for AML. Our first objective will be to understand what components of nutrition will have the greatest impact on treatment outcomes and in preparation for stem cell transplant. The second will be to understand the role of vitamins, minerals, and herbal supplements in AML treatment. And lastly, we will identify credible resources for nutrition information that you and your families can access throughout your treatment course.
All right. So while Victoria and I have a lot of training and experience in hematology and BMT, our discussion today is really not meant to be just us throwing a bunch of facts and figures at you. We really want to send you away today with a base level of knowledge that's grounded in evidence and some practical ways to approach your nutrition during AML treatment. Essentially, we want to provide you helpful and clear information that can help you make decisions that are based on evidence and not on fear. As with any group presentation that you hear anywhere, it should not be considered personal medical advice because we unfortunately don't personally know you. We do encourage you to always discuss your specific nutrition goals with your care team, and always ask for a referral to a dietitian, a registered dietitian, because you have access to a registered dietitian, whether you see them there every day or not. All right, so before we get into this, I think one of the big things that we need to zoom out and look at is the timing, the time of the continuum of cancer treatment that you are in right now. And I'm just assuming that you are all relatively newly diagnosed with AML. That might be completely wrong, but that's the part that we're talking about today. We're talking about active treatment and recovery. So as you, I'm sure know, cancer is not a one size fits all. And not only are there literally hundreds of discrete types of cancer and treatments, all patients go through different phases of the cancer nutrition continuum. As dietitians, we usually think about it as cancer prevention and risk reduction, which essentially all of us have gone through at some point, right? Then there's the active treatment and recovery phase and cancer survivorship. And really, the moment you're diagnosed with cancer, you become a cancer survivor. But we're focused today on talking about active treatment and recovery because that's the phase that Victoria and I work in all of the time. It's important to bring this up though, because a lot of what we hear about in the media in terms of nutrition and cancer, nutrition and leukemia, are really recommendations about cancer prevention. And that's because that section of the pie applies to a great number of people, right? And there's a lot of really wonderful information in that space. But nutrition guidelines for patients who are going through active treatment look quite different sometimes than what we see for cancer prevention and cancer survivorship. And we hear about them a lot less. And the active treatment section, after active treatment and recovery, or what we oftentimes refer to as early post-treatment, has a much greater emphasis on optimizing nutrition that prevents malnutrition, because in this recovery phase and active treatment phase, malnutrition is associated with a lot of negative impacts such as treatment interruptions, hospitalizations, and other adverse outcomes. So we're going to be talking today about the importance of getting adequate calories and protein that prevent the loss of lean muscle tissue, some of the ways that you may have to modify your dietary intake because you have certain treatment side effects that don't allow you to eat as you normally would. And then we're always in the back of our minds have adequate hydration there. Now, prevention and survivorship nutrition goals, there's overlap with active treatment and recovery, especially in the space of maintaining lean muscle mass. But there's a much greater emphasis on what we often think of as a healthy eating pattern. And this is where things can get a little sticky sometimes because what we think of as the diet or the perfect healthy diet for cancer prevention and survivorship might have to shift a bit when we're going through active treatment. So we recognize that this new diagnosis can be overwhelming and honestly a little bit scary. One of the things that Victoria and I are acutely aware of because we work with patients who are relatively newly diagnosed is that, you know, it's never, nobody wants to hear that they have cancer, but when you're diagnosed with AML, it's pretty abrupt, right? You're feeling kind of crummy, you finally go to the doctor. Not only do they tell you that you've got cancer, but they tell you we need to start treatment like tomorrow or you won't be here in a month, right? That's pretty overwhelming. And our human nature when we have something like that happen is to do a bit of self-blame about what we did to bring this on. And somehow nutrition and our lifestyle always comes in there. Like, what did I eat? I'm sure it was because I didn't, you know, peel my vegetables or whatever crazy thing you've heard. So it's pretty common to sort of self-blame and focus on nutrition. So rather than being paralyzed with fear about or guilt about how you got here, what we're hoping for today is that we can help you feel empowered to take a bit of control over just this small part of your health, this nutrition piece, as you proceed and move forward in this treatment. So we're going to talk about some of the big things today that dietitians working with patients who have AML are most focused on. And it may look different than what you expect. And I'm going to tell you why that is. So our main goal when a patient's going through a really intense treatment like those for patients going with AML is to maintain lean muscle tissue. And this doesn't mean like we want you all to be bodybuilders. That's not it at all. But we know from a lot of evidence that patients who are able to maintain strength and lean muscle tissue have better tolerance of their treatments, decreased infections, fewer hospital admissions, and improved recovery after they get through their acute phase of treatment. And so the two main prongs of maintaining lean muscle tissue are getting enough calories and protein and physical activity. And when we talk today, we're going to talk quite a bit about malnutrition. And malnutrition has a clinical definition for those of us working in medicine and nutrition. And malnutrition is a significant negative consequence of a lot of different cancer therapies. And in patients with leukemia, we know from evidence that malnutrition unfortunately also correlates with poor outcomes both before and after a stem cell transplant, for those of you that are assuming a stem cell transplant. So I really want to clarify that when I talk about malnutrition, we're talking about a constellation of symptoms and downstream effects that include poor intake, weight loss, changes in body composition, that ultimately mean the body is less resilient to all kinds of stresses. And I think another thing that is really important to talk to you about as patients and caregivers is that malnutrition occurs at all body sizes. Being exceptionally lean or skinny or thin does not mean you're malnourished, just as having extra fat on your body or being overweight does not mean you're not malnourished. That's a very old definition of malnutrition, where just thin people are malnourished and larger people are not malnourished. That's not true. We know that the biggest factor in malnutrition has to do with actually the lean muscle tissue that our body has, because that's what helps to keep us strong to maintain us through these intense treatments. So a little background on what research exists. So there's been a few studies in patients with AML, treatment phase of AML before transplant. A study in 2019 of hospitalized patients with a variety of hematological malignancies. Most of them were acute myeloid leukemia. And those patients who had a diagnosis of malnutrition along with their AML had a much higher risk of mortality. And that mortality risk and malnutrition were independent of how old the patient was or how advanced their disease was. So that means that it's an independent risk factor for complications during AML treatment. And then there's been a lot more studies about malnutrition in patients in the transplant phase. So leading up to transplant, stem cell transplant, and throughout transplant recovery and post-transplant. And in multiple studies of those patients who had malnutrition heading into transplant had significantly more hospitalizations. They had longer lengths of stay when they did go into the hospital. They had increased mortality, and that mortality was unrelated to their underlying disease or their treatment types. So again, it very much appears that nutrition is an independent risk factor. Malnutrition is an independent risk factor for poor outcomes during AML treatment and post-transplant. So this is why, as dietitians, we put so much emphasis on maintaining good nutrition during AML treatments. And when we say good nutrition, we're really focused on this maintaining lean muscle tissue, because that's the part that we have huge amounts of evidence that make a difference for your outcomes. All right, so malnutrition doesn't, it's not even inevitable. I think that's something that's also a little bit of old thinking, like, oh, you've got this diagnosis, these treatments are really harsh, and you're just going to become malnourished. And that's just absolutely not true. Certainly you have a really high risk of it, which is one of the reasons you have access to a dietitian, but it's not inevitable that you're going to become malnourished. But there is a cascade of events that lead to this loss of lean muscle tissue. And I love this image because this is a picture of this cascading waterfall. And this waterfall, this is a picture that I actually took. This water just seeps out of the ground. It seemingly comes from nowhere in small little trickles, but all these little trickles gather together to create this much larger waterfall. And then it creates this roaring river. And I think of this a lot like, a lot like the nutrition impact symptoms that first start out sometimes before you're even diagnosed, but definitely are there when you start going through AML treatment. And nutrition impact symptoms is a term that we use in medicine and nutrition. And it can be as simple as a bit more, things smell a little off to you. You've got more fatigue, a bit more dry mouth. And any one of these things, by themselves don't ever seem that significant to us. But they sometimes creep in slowly and we don't notice them happening, especially when we've got a new diagnosis and we're suddenly dealing with all the other things that come with having that major diagnosis. But these things tend to be what leads to changes in our nutrition intake, our oral intake. And that's both changes in the amount of intake and the types of intake. And it might start with these small symptoms and you experience them a little bit more frequently or they're a little bit more intensely. If we ignore them, they lead to these changes in the types of food that we eat and the amounts that we eat. Now, just a simple change in the types of foods that you eat or the amounts that you eat don't necessarily mean that's going to lead to bad consequences. If we are strategic about how we change things when we're modifying things to deal with nutrition impact symptoms, we can prevent that from happening. But oftentimes what happens is we're in this time of decreased supply because we've changed how our intake is happening, how much or what types of foods. And then we're going through this time where we also have these increased needs because we have, major treatments that our body is trying to deal with. And meeting the demands of that treatment, oftentimes we need more nutrition than we've needed in the past at a time where we are able to get less. So these symptoms and changes don't always stand up and slap you in the face, right? Sometimes they sneak in, but you should not assume that they're just going to resolve on their own, because as they happen slowly and creep in suddenly, that's when you're all of a sudden looking at, wow, my legs just aren't, as robust as they used to be, or you really notice I don't have any fat on my butt anymore. And that's when we know we've lost some lean tissue. So if you can't, this is my goal. So I want you, when you have this very first tiny trickle of a cascade of that flow coming where it just comes out of nowhere, rather than saying to yourself, well, this is just what's going to happen with this cancer, or this is just what's going to happen with this cancer treatment. I need you to speak up about them and ask for help about how to deal with those nutrition impact symptoms. Because if you can't eat what is normal for you, and this is not what's normal for other people, if you can't eat what's normal for you, you need to get the help of a dietitian to make sure that what you can do is enough for you and it's the right type of a nutrition for you. Okay. So the whole key is intervening early, and you're the best one to know when that early is for you.
Okay, so Joy just gave us a lot of great information about nutrition implications on treatment. And now we're going to change gears just a little bit to help you put that information into practice. So our ultimate goal is to obtain the broadest variety of foods and beverages that you can tolerate while maintaining adequate calories and protein. So there may be times during treatment when there may be very little variety in your diet. And if you're still able to meet your calorie and protein goals, even if it's through milkshakes and smoothies, that's okay. I also want to emphasize the word tolerate here, because your tolerance to foods can change quite rapidly, as quick as hour to hour, based on your symptoms that you may be experiencing. So it is important that if you did not tolerate one food early on in treatment, that you don't completely omit it, because you might tolerate that later on in treatment so that we can obtain that larger variety of foods throughout your treatment course. With that being said, it is best to have easy to prepare high protein foods available to you, as this can help make things a little bit easier if you are to experience something that you're not tolerating well at the moment, that you have something to fall back on. And Joy and I also want to just recognize that during this time, it's important to give yourself some grace. So Joy touched on this earlier, that idea of what a healthy diet looked like for you previously may not be very feasible for you during treatment. And that term healthy does change. It's very relative. So oftentimes we like to associate foods as being good or bad, and that really is not always the case. Foods nourish us in a lot of different ways. So it's important that we give ourselves some grace, because what might have been healthy for us before may not always be healthy for us during treatment. So we keep mentioning these protein foods a lot, and it's important for us to just review what those are so that you know what sources of foods are good protein sources for you. So I like to think of protein foods broken down into 3 different categories. First, we have our meats and our eggs. Then we have our dairy foods. And lastly, we have those plant-based proteins. And the consensus of evidence does show that ideally, 65% of our protein intake during active treatment should come from animal sources. So these would be our meats, our eggs, and our dairy foods. And the rationale for that is that plant-based proteins often don't have all of the right kinds of protein that our body requires. And we have to oftentimes eat them in larger quantities in order to maintain our muscle mass. And this is probably a lot different from what you might have heard in the media, especially in terms of nutrition and cancer. Oftentimes we do hear a larger emphasis on incorporating more plant-based proteins in our diet. However, that is oftentimes the case for cancer prevention and survivorship, but that may not always be the best sources of our protein during active treatment. So Joy and I did also come up with a lot of different foods that we often see our patients eat, where they're oftentimes lacking protein and where we're encouraging more protein to help them. So the first that we see a lot, and I saw this morning with one patient, is buttered toast. We don't have a lot of protein here, and oftentimes this is, I think, a go-to, especially if you're feeling nauseous. But the easiest way that we can add protein to this is to add some peanut butter onto your toast. The second is fruit, and fruit does not have any protein, but it can be helpful if you are having taste changes or dry mouth. And we can't necessarily swap that out for something, but we could always add protein to our fruit, such as adding a cup of yogurt or even a cup of cottage cheese. And then we have almond milk. So almond milk has very minimal protein in it. However, there are other plant-based milks that do have protein, such as soy milk. And I do notice that they are starting to make a lot more almond milk and other types of plant-based milks that are fortified with protein. So this would be a great opportunity to compare those nutrition labels when you're in the grocery store shopping to see which product does have more protein in it. So we did mention that hydration is important during treatment. And when and if your variety of food and beverages becomes very minimal, it is important that we optimize and capitalize on what you are able to consume. So an easy swap to get some added nutrition is to swap that water out for a protein drink. That way we can still maintain our hydration, but we can also add some protein and calories that way. So then we have things like cookies and other desserts that do lack protein, but the easiest way we can add some protein to that is to add a glass of milk. And finally, we have some pasta. So again, this tends to be a go-to food if you're feeling nauseous. It does tend to be a comfort food, and pasta doesn't have a lot of protein in it, but if we were to swap that out with something like egg noodles or even the bean pastas that they're making now, such as the chickpea pasta, we can add more protein to something that typically lacks it. I know Barilla is also making a protein fortified products. So again, comparing labels in the grocery store can help you find that higher protein product. And a great question that might be helpful is to always ask yourself, is there a protein here when you sit down to have a meal or a snack? And if there's not, how can we add protein, or what can we do to swap something out to get that extra protein in? Okay, so we've made it to vitamins, minerals, and herbal supplements. And this tends to be a pretty hot topic in regards to cancer. And the best place and the best source for us to obtain our vitamins and minerals is from our food. Taking vitamins, minerals, and other herbal supplements without medical advice may not always be helpful, and it can be harmful. Some of these products can interact with medications, chemotherapies, and it can also alter blood levels. So some different kinds of chemotherapies work through a process called oxidizing. And when some vitamins, such as vitamin C, are taken in large quantities found in supplements, it has an antioxidant effect. So oftentimes that does make chemotherapies less effective. Another thing to be mindful of is that when we are taking high levels of certain vitamins and minerals, it can cause an imbalance in other levels of vitamins and minerals in our body. So one example that comes to mind is zinc and copper. So when we take too high levels of zinc, it does reduce our copper levels and vice versa. And that's often an imbalance we don't want to interfere with. We also recognize that during this time, you are taking a lot of different medications and pills multiple times a day. So we don't want to add to that pill burden by adding an extra vitamin and mineral to your regimen. One vitamin that we do often see supplemented in our practice is vitamin D. Oftentimes this can lead to lower levels, especially if patients are having a lower variety of the food intake that they're tolerating, and if they are having long hospital stays because they're not getting that time in the sun to absorb the vitamin D. So oftentimes this is supplemented before transplant if this level is found to be low, as studies do often show that insufficient vitamin D levels can lead to complications following transplant. And probiotics is also a common question a lot of patients have. And probiotic pills, powders, and capsules should be taken with caution, as it can be associated with bloodstream infections in immunocompromised patients, and it has been shown to make some immunotherapies less effective. However, here at Mayo, we do not restrict the use of probiotic foods, and these are foods like live active culture yogurts, kefir, kimchi, sauerkraut. However, this can vary by institution, so we would recommend that you do get in contact with your medical team to see what their recommendation is in terms of probiotic foods. So ultimately, our recommendation is to consult your doctor or your dietitian before starting a vitamin, mineral, or herbal supplement to make sure that it is safe for you. Just because you might have heard a neighbor or a friend be prescribed or recommended a certain supplement, it may not always mean that it is safe and the most appropriate in your situation.
Thanks for that, Victoria. That leads to a good segue. So, several years ago, I was at a picnic, and there was a friend of a friend who sat down next to me, and she had just been diagnosed with breast cancer. And my comment to her was, "What's the thing that has surprised you the most about being diagnosed with cancer?" And the very first thing she said, and she had no idea I was a dietitian, was the number of people who give you advice about nutrition. After that, it was fatigue. And I think that that's extremely common. And as Victoria said, like, what's right for you is different than what might be right for your sister-in-law who had this type of cancer, or even somebody else in your own, patient caregiver group that has the same disease. So it's very challenging to find reputable, in-depth information about nutrition and cancer on the internet. Either I find it very vague for somebody who's actually wants to find some in-depth information, or I just don't trust it. And so we wanted to put together just a short list of resources. And I will tell you, these are resources that I use myself in practice, and I also share with patients on a very regular basis. And I want to explain a little bit about what they are. So the first two are organizations. So the first one is a group of cancer dietitians. That's all we do. And this is their website includes a site that's specific for dietitians, the professional side, but they also have a public side of their website. And the Eat Right to Fight Cancer section of that has some really helpful, frequently asked questions and answers that are evidence-based. The references are listed there. They're timely and practical. So we're not always waiting for 10 years of evidence to tell us something is helpful or not helpful. So we wanted to give patients information at their fingertips that they can use. You will find questions and answers in there to things you've probably already asked or thought about, like what can I eat to raise my white blood cell level? Or how is eating this sugar making my leukemia worse? And so you'll find some very in-depth responses to those questions and answers at that website. And there's also some great recipes and how to deal with all different symptoms and side effects. So a nice website to bookmark. The second one is a much larger website, the American Institute for Cancer Research, which again has a professional side and a side for patients and the public. And American Institute for Cancer Research does cancer research on all stages of that cancer continuum. So cancer nutrition continuum. So before treatment, so prevention and risk reduction, as well as active treatment, and then after treatment. And again, there's a lot more specifics here about nutrients and foods in general. So when you are told you need to be getting more magnesium, this website has a great breakdown of, okay, what foods are great sources of magnesium, and then linking from there into recipes that can provide you with more of things that use that food and that nutrient. So I think it's a very robust website that I refer patients to all the time. So the third website is actually a private website. And I'm often very skeptical about any website that ends in .com, because oftentimes it means somebody is trying to sell you something. In this particular instance, this is a website that's run by an oncology specialist dietitian named Julie Lanford, who has a fantastic collection of free resources for patients and caregivers. And it's a lot of the same information that's on these other websites that I've talked about, but she really has a patient-centered focus because that's what she does. She works with patients who have cancers of all types as they go through their treatment and in their survivorship phase. And what I like is that she presents things in lots of different ways. So there's a blog and there's recipes, but there's also a podcast and there's free webinars. And so if you're not just wanting to sit in front of your computer and read, if you like to send a friend a podcast about sugar and cancer that you can hear some real expert advice on, that might be a way that you can share these things. So this information is not just for you, but when your friends, relatives, neighbors have questions about or want to give you advice about things, it's nice to be able to say, oh, I've got a really great resource about that, and this is what I know about it, and I've read about it, and this is based on evidence. So these are all three sites that I feel really comfortable sending people to. This is where I go to find information sometimes when I don't know what specific things I'm looking for. So if I were going to send you away with 3 spots to go to, these are the 3 I would send you with.
Okay, and we're going to leave you with just a few final thoughts. So if there's anything to take away from our presentation today, it would be these. The first being that nutrition does play a role in AML treatment, recovery, and your outcomes. If there's things to focus on in your nutrition, it should be protein and calories. Get nutrients from foods, not necessarily vitamins, minerals, and herbal supplements unless directed by your medical team. And lastly, just be mindful of using credible resources when you are seeking out that information online.
All right, Katie, I think we're ready to open it up for questions.
That was so great, Joy and Victoria. Thank you so much for that informative presentation. I think I'll take the screen back here and share my slides once again so we can move into some discussion and Q&A. So again, you can submit questions either way. We're a smaller group, so if you want to verbally ask a question, that's certainly fine, or make a comment about anything we talked about today. Or if you'd like to go the chat route, you can open up the chat box in the bottom of your Zoom screen. So let me see, I haven't seen any chats come in, but while they do, I had something come up that maybe we can start with. You mentioned the importance of maintaining lean body mass as kind of one of the main priorities when we focus on nutrition and AML treatment. And I'm curious, if I'm someone who wants to be as proactive as possible and try to avoid that cascade, that waterfall cascade of occurring, and I want to stay at the top of things, what are some ways that I can maybe monitor my lean body mass? How do I know that I'm maintaining it?
That's a great question. And I'm not a physical therapist or a physiatrist, so I don't want to speak for them. But I will say that one of the things about those initial nutrition impact symptoms, sometimes people will say, well, I've got them, but that's it. So my question always is, are there any symptoms that are preventing you from eating or drinking normally or being as active as you need to be? And so again, identifying those things that are making it hard to begin with, and then getting interventions for those as quickly as possible. So you can move around more. If fatigue is your problem and you need to be able to have more energy, finding out what times of day work good for you. So self-monitoring your physical activity and lean muscle mass, a lot of times, I don't know that there's a strategic way to do it, but patients will tell us what we see as patients telling us, I noticed that I don't have my muscle on my legs is gone, or oftentimes it'll be a caregiver who says, yeah, my husband doesn't have a butt anymore. They lose some of that muscle back there. Hopefully we don't let it go that long, but I think it's a little bit easier to monitor your stamina and your ability to tolerate the typical daily activities. So, is it hard for you to get up and down the stairs? Are you able to walk as much as you were before? And maybe you weren't walking any before, and that doesn't mean you need to stay at that baseline. You can still try to increase your walking, but this is an area of such great focus for treatment, because we are understanding that this physical activity component during treatment, and especially before and after transplant, is really important. So just like with nutrition, I would say talk to your team about that being active piece. Ask them what's safe for you. As dietitians, when we do a malnutrition assessment, we're looking at different muscle components throughout your body. We're looking at different areas on your body that indicate your lean muscle status. But you're going to know better based on what you tolerate for physical activity. Does that answer your question, Katie?
Yeah, absolutely. I think you make a lot of good points that it's important to be really in tune with your body and how you feel and how that changes over the course of treatment, which might be good to document and journal for yourself. I think that's a good point too, saying that it's both nutrition and movement. These things need to go together in order to best maintain your lean body mass.
Yeah.
I see a hand raised from Catherine. So if you want to come off mute now, we can take your question or comment.
Hi, this is Catherine. I just wanted to make a comment about the protein aspect. I have AL amyloidosis with kidney and liver and gut involvement. And I'm just going into my 4th week of chemotherapy, and met with a nutritionist a couple of weeks ago, and they actually cautioned me from getting too much protein, which, I mean, there's no danger of that right now anyway, but yeah, go ahead.
So what I would say is, when you're talking about AL amyloidosis, which we work with a lot here at Mayo Clinic as well, there's no evidence to suggest that your dietary protein intake has anything to do with those protein deposits in AL amyloidosis. Now, I don't know your specific involvement of your kidneys, so that may be a completely different issue. I would say that getting a whole bunch extra protein for you isn't necessarily going to be helpful. But yeah, not knowing your specific situation, I don't want to comment too closely. But as you said, it's generally very hard because of the symptoms you're having through this treatment to get enough protein. So I would help to understand what your goals are for protein from your dietitian, and then work to make sure you're getting that much. You shouldn't be skimping. That's not going to help you.
I think it was maybe because there's more, it causes more, I don't know, for the kidneys to work harder. Or...
Yeah. And that's what I was saying. Like, it depends what stage your kidneys are at, but even that is very, very relative and will change as your treatment progresses. Your kidneys should get better as your treatment progresses, and you'll be able to tolerate more protein without it being an issue. So yeah.
I see. Thank you.
Yeah. It's not it's not a snapshot, right? You're in a video. So.
Right.
A few things coming up in the chat. Archana, and I really hope I said your name right, feel free to correct me, is asking, are fruits allowed during treatment, and which ones in particular? And I imagine your answer depends on where in treatment we're talking here, right?
Yeah. So there's a lot of things that go into here. I think what a lot of people have heard in the past is that when their white blood cell counts are low, they need to limit certain fresh fruits and vegetables. And I can tell you that that is really no longer the case. The USDA has guidelines for immune compromised people that include patients going through cancer treatment, patients who are going through stem cell transplant, solid organ transplant. And there are many ways that you can consume fruits and vegetables in all types, fresh, frozen, canned, cooked, in safe ways. They do need to be washed well, and the USDA has great guidance on that. The other aspect that Archana might be thinking about is there are some medications where there are certain fruits that may interfere with the way that medication is metabolized in the body. So we sometimes have to limit specific fruits during certain types of treatment. But yes, you can certainly find all kinds of fruits and vegetables in all kinds of ways that are safe for you to consume. Now, much like what Victoria was talking about with the probiotic foods conversation, there are still some programs, some cancer programs that are maybe using some older guidelines about food safety for fresh fruits and vegetables. We don't do that here. We don't have any restrictions on fresh fruits and vegetables as long as they are washed well and in good condition. And we teach patients how to do that. But that's not necessarily the case at the program that you're working through. So I would say that they probably have their own guidelines. I'd always refer people to the USDA guidelines for patients that are at risk, and you can find those online, and they'll do a lot of great information about how to make sure you get good quality things that are, and how to clean them. So yeah,
Great.
That's my 2 cents.
Yeah.
Anything?
Oh, go ahead.
No, go ahead.
I'm so glad the conversation came up. I think that's a huge one and can be a really big misconception. And there's been a lot of reinventing when it comes to the neutropenic diet, and it makes my heart happy that it is super.
Yeah, we actually,
of course they would be, but I'm happy to spread that.
Here at Mayo, we haven't had a neutropenic diet since 2014. Because there was never really any evidence that it was helpful. And there's a lot more research in recent years, recent decades, that especially for patients who are going through allogeneic transplants, the more restrictive diets they were on, they actually had more infections and worse outcomes, which might have to do with the fact that we still need some variety. And when patients are coming into a treatment scared of their food, that just reduces that variety that we're talking about. And like when Victoria and I were talking about, what we want you to do is be able to consume the broadest variety of foods that you can and still get your calories and protein met. So I encourage you to seek out that information, but that's a great question to ask. Thank you.
Yeah, I think that's a big mindset issue that people run into, is needing to be more restrictive, needing to have that fear that food could cause something, and shifting your mindset away from what do I take away to like, what can I add to my diet makes a world of a difference. So
Yeah.
great. Something here in the chat from Julia, who says she's undergoing maintenance chemotherapy. Her sodium level is dropping. This may or may not be chemo related. Are there any particular foods I could add to my diet to increase sodium? Her doctors have suggested reducing fluid intake. However, to me, fluid intake is more important for avoiding constipation.
Oh, that's a terrible situation to be in, Julia. Yeah. This unfortunately happens a lot. There isn't very good evidence that increasing sodium in your diet, with the kinds of consequences that usually lead to hyponatremia or low sodium for patients like yourselves, there's not a lot of evidence that eating high sodium foods is going to help raise your serum sodium in your blood levels. The best thing usually is to be reducing fluids. So, yeah. So I would say that usually these things are also kind of transient, so it shouldn't be something that you have to deal with forever. And I would try to incorporate every other way you can to reduce the constipation, because they shouldn't be asking you to drink so few fluids that it exacerbates your constipation that much if we can get things through food. And again, I don't know your specific situation, but we do see this. Victoria can probably comment on it more because she works with a lot of people in maintenance. So
Yeah, I have seen it quite a bit. And I think one thing that I've noticed with my patients is that oftentimes we're restricting free water. So what that means is that is just straight water and things like juices and even lemonade, coffees and teas, things where our bodies are essentially just absorbing the fluid from it. That is what we are restricting. So sometimes adding things like the protein drinks usually are allowed, at least in the experiences that I've handled things like this. So that might be something to consider with your doctor, that you may not have a restriction on things with added protein to them, but really just that term free water.
Can I just add another add-on question to that? I think my doctor had suggested that having more protein maybe helps maintain the sodium level. Is that true?
Yes. Yeah.
Okay. So that's something I could work on.
Yeah, there you go. Yeah, sodium or having enough protein in your diet helps keep your blood in your blood vessels. Does that make sense? So when we see patients with very low protein, they also have a lot of extra spacing. Their fluids are outside of their blood vessels, like puffy ankles and things like that. And so one of the keys is to get enough protein, because that is part of what helps your body keep the protein in your bloodstream so you can pee it out. So.
Thank you very much.
Yeah.
Something here from Bill and Pat asking if you can comment on organic versus non-organic foods. Big topic.
Yes, it is a big topic. So what I'll say is that we know that during treatment time, during active treatment, I frankly don't care. I need you to get your calories. I need you to get your protein. Usually when people are talking about organic produce, fruits and vegetables, organic foods, they're talking about as it might relate to cancer prevention or more incidence of cancer. And the bulk of evidence shows that the greater risk to risk reduction for cancers of all types is a wide variety of fruits and vegetables in your diet. And it doesn't matter what that variety is, if it's organic or non-organic. The bigger factor is if you're getting a wide variety of fruits and vegetables. And I can tell you that it's less than 10% of Americans who are getting their required amount of fruits and vegetables every day. So we have a lot to work on. I think there's also a lot of fear. This is one of those things that I feel like because it is a hot topic, it's easy when you get a diagnosis to be like, oh my God, it's because I haven't been eating those, organic strawberries that the, clean 15 or whatever, the dirty dozen or whatever says is bad for me. And, that's one of those things that just really isn't borne out in evidence, the bulk of the evidence at this point. So there's other reasons to eat organic. I mean, I'm a big fan of supporting my local farmers. I'm very lucky to live in an agricultural wonderland in Minnesota, where we have, we have options for lots of locally grown things that are oftentimes grown with less chemicals. And there are reasons to choose it, but from a nutritional standpoint, the most important part is that you're getting fresh fruits and vegetables. And I know that's the answer that everybody knows a dietitian is going to say, and they don't seem to be happy with it, but that's really still where all the evidence lies. So.
A very fitting question, as those lists, the Dirty Dozen and Clean 15, just come out. They're right these days. I think I saw it last week come out. So
yeah.
Okay, something else here from Archana is asking, well, chemotherapy is creating mouth sores and gastritis, and asking for suggestions to manage these things.
Yeah, so I'm going to actually, because, in the interest of time, I'm going to point you, Archana, to some of those websites that I put up, because they all three of them have great sections on what to do if you have mouth sores. And, one of the things that has surprised me as a dietitian is that it's not always cold stuff. I used to think that, everybody will do better with a milkshake, but sometimes really cold stuff is actually more painful. So it might be very specific to you to find out what textures, what temperatures, what types of foods. So sometimes really salty things or really tangy things hurt more. Sometimes milky things create more phlegm. So you're really going to have to see what works for you. There's no one size fits all, but those websites will give you a lot of great suggestions, and probably also link you to some good actual, practical recipes and things like that. I would I would say that this is one of those, first trickle of a cascade that starts, and it's not inevitable that you're not going to be able to get enough, but this is where you might really have to shift. If you can't eat solid foods anymore because your mouth is really sore, you're going to have to make sure that the liquids that you're getting in, or the soft solids, are really good sources of protein and calories, or you won't be able to meet that balance. So I hope you have access to those websites.
And I'm going to send a follow-up email to everyone registered. So you'll get the slides that were shown today. And I'll include all of the links that Joy's mentioning for you to easily access. So don't worry if you didn't take notes. Let's see, anything else coming through? Anybody have a comment they want to come off mute for? And I'm not seeing anything come up in the chat. I have one more thing we could talk about. We have a few more minutes. We've talked a little bit, we've talked a lot about the importance of protein. And we mentioned that protein shakes can be a significant source of protein that can help us maybe when we're not feeling like setting and eating a full meal. Maybe you both could walk us through what a protein shake could or should entail. What would be your ideal protein shake for somebody to consider?
Yeah, I mean, can we just all be honest that the picture that came up when we talked about protein shake, everybody goes, I mean, we're realists. We do it too. So yeah, it doesn't have to be a commercial protein shake, right? A lot of the medical grade commercial protein shakes have a lot of added vitamins and minerals in them, which are helpful when you don't have a varied diet, which might be for short periods of your time. But unfortunately, those added vitamins and minerals are also generally what makes it taste kind of crummy. But there are such a wide variety of commercially available protein drinks now. And, in the last decade, in general, nutrition in your grocery store, you've got now all these protein drinks, a lot of which are perfectly fine and safe for you to have. I would ask your dietitian about them, because sometimes they like to add like energy boosters or probiotics to them, and those we'd want you to be cautious about. But there are protein drinks you can get at the grocery store. There's also just milk, and a lot of people a lot of our patients now are really liking, there's some high protein lactose-free milks, and we don't promote specific brands here, but it's called Fairlife, and a lot of my patients like it. So, I mean, that ends up having as much protein as an Ensure Plus, but it tastes like milk, and you can use it to make your oatmeal in the morning or other ways that you don't have to sit and drink it. But a protein shake, basically, you know, there's the medical grade ones, there's ones you can get at the grocery store, there's things you can make at home. And if you start comparing protein in labels and things like that, you're going to find that, oh, wow, I could make this hot cocoa at home, and it had with this Fairlife milk, and it has just as much protein or more protein than this standard Ensure drink that I have, and it tastes a lot better. So I wouldn't be swayed just by what the name of something is, like, you know, super protein or max or something like that. Look at the numbers. And then, of course, do you want to drink it, right? One of the things that I think people get really tied into is that these drinks are all creamy, and that's not true. One of the things that's gotten really a big boost with the use for cancer populations is clear drinks. So a lot of these protein drinks now are made as clear solutions that are either like fruit flavored, like really tangy fruit flavored. There's some that have a really mild fruit flavor or like a minty aftertaste, which I know sounds weird, but it gives kind of a cooling sensation. So they have all different types. So just like with everything else, I would say find what flavors you like. If you're liking fruity things, if you're liking tart things, then gear towards that. And maybe you don't drink a straight up protein shake. Maybe you blend it with some frozen fruit. So you're still getting the protein, and you're also getting some fruit and some other flavors, maybe to cover up the medicinal type taste. You know, if you can't tolerate fruit and you're really wanting ice cream, well, ice cream doesn't give you a lot of protein, but let me tell you what, every single one of those medical protein drinks taste a whole lot better with a scoop of ice cream mixed into it. So if that's something that you need to get more calories, I joke with patients all the time that I went to all these years of school just to tell you that Ensure is going to taste a whole lot better with a scoop of ice cream. So other ideas, Victoria?
No, I was going to suggest the ice cream, because if anyone here does have a lot of those medical grade protein drinks already at home and you may not like them, certainly mix some ice cream in with that to see if you tolerate it a little bit better.
Yeah. We have a few minutes. I have one more that's come up from David, and I think we'll end on this one. He is more than 5 years after his unrelated donor transplant and is asking for any nutrition advice for him during this time.
Are you 5 years, David, or 5 days?
5 plus.
Plus 5 days?
Did I read it wrong?
I don't know. It just says +5, which we usually talk about in days.
Yeah.
So
yeah,
if you're day +5, you've got a dietitian on your team, and she's going to work with you. She's going to work with you closely. So days, yeah, there we go. I assume so, because that's how we do days. But well, good luck to you, David. I would say, like, don't give yourself some grace. Do give yourself some grace. But you should already be looking at, okay, what is in front of me? What's got protein? How can I get a little bit more protein in there? And I'm sure your team would tell you to make sure you're drinking well too. So.
And thank you for being here, David, on day +5. It's amazing.
Yeah, it is.
Big thank you from Julia, saying this was wonderful and very.
That's so nice. Thank you, Julia.
So I think we'll wrap up now. What a great discussion we had, and we had the conversation before the presentation today that we'd really like to take your questions today and build them into more detailed presentations as we go forward. So now that we have an idea of what some of you are more interested in, we might have some more nailed down topics in the future. Okay, so I'd like to mention that our next adult AML chapter meeting will take place on April 21st at 6:30 p.m. Eastern. We'll have an exciting discussion about the power of using reflective journaling and creativity to support your own personal recovery and growth. Our speakers, Julie and Eileen, will also reveal that they are inviting the HealthTree community to participate in a free 8-week journaling workshop over the summer. So you'll want to attend this event to get more details. You can find the registration page for this event and others by visiting healthtree.org/AML/community/events. And once again, thank you to our HealthTree community for AML event sponsors, Bristol Myers Squibb, Amgen, Genentech, AbbVie, and Jazz Pharmaceuticals. And thank you for helping us to build a strong HealthTree community for AML. I appreciate you all for being here and hope you have a great rest of your day. And I can't wait to see each of you again on April 21st.